Well, are you ready to switch to some conspiracy shit about vaccines?
Can't wait.
Even more conspiracy laden than Greg Locke up there.
What? That's not possible.
Yeah. So, Anna de Lorraine, I think is her name.
Oh, okay.
She's on what's that Alex Jones show?
Dumbass Central.
Dumbass Central. The Alex Jones's show. She's co-host on there, and so they had somebody on that was gonna talk to people about the dangers of the vaccines.
Okay.
The people now that are learning more about the adverse impact of getting vaccinated, they're having regrets about it because we're hearing about this shedding that's going on, and
the vaccine shedding,
and also the activation of the graphene oxide. It's actually sitting there dormant, but if it gets energized by something like 5G, it actually kills all the cells around it. That is so crazy to me. I mean, can you imagine if they just like activate and said, "Oh, all right, 1 million people are going to be gone," just by energizing the graphene oxide.
And that's the thing. People don't really know exactly what's in it. Those people, Biden, even Trump, any of these representatives, they're not taking the real vaccine live on TV when they pretend that they do. That they're not that stupid. They're not doing that. They're leaving us to do that.
So, honey, the government, Trump's government, by the way, developed the vaccine with graphene oxide so that he could flip a switch and vaporize 1 million people.
That is very stupid. Can we address the vaccine shedding part real quick? Because I've heard a lot about people saying that the vaccine gives people COVID because of vaccine shedding. That is absolutely 100% false. It's vaccine shedding is a term that describes the release or discharge of any of the vaccine components in or outside of the body. And it can only occur when a vaccine contains a weakened version of the virus. Okay. It can only occur when that's true. None of the vaccines authorized for use in the United States contain a live virus. None of them.
Right.
Actually, none of them even contain dead COVID-19 virus. None of them.
Oh, yeah?
No, the J&J vaccine is the older technology, right? Mm-hmm. But it contains a different, they have attached the spike protein information per se to a different cold virus. They did not use COVID-19 in the J&J vaccine. And the mRNA vaccines, that's just not how they even work.
Right.
So, and those are against the spike protein, not against COVID. So COVID-19 is not in any of these vaccines, weakened and live or dead. So vaccine shedding is impossible with these vaccines.
Yeah, exactly. But do be cautious because that the Delta variant that's out there right now, the problem with the Delta variant is that even though if you're vaccinated, you won't get as sick, you won't get deadly sick, but the COVID-19 can reproduce enough to where you could potentially spread it to other people.
Yes, you can still get it and spread it, but that's still not vaccine shedding.
No, it's not vaccine shedding, but I just I thought I'd put it out there that with the Delta variant, there is still a possibility of spreading the Delta variant because of how it operates. So it's still very important to wear a mask.
Yeah, it's super big bad. Like this Delta variant is some bad shit. Even for vaccinated people. And again, like John said, it's highly unlikely that you would be severely sick if you're vaccinated from the Delta variant. But you can be infected by the Delta variant with any kind of contact or exposure to it within a minute. Remember with the other variants, it was like, well, you have to be in close contact with somebody for around 15 minutes for there to be enough like aerosols in the air to actually infect you, for you to breathe in enough to infect you. With the Delta variant, it's close contact for 1 minute. And you produce so much of the virus. It reproduces at like 1,000 times the rate of the previous variant. Yeah. And so you produce so much that you can get sick. Again, not necessarily death sick. I mean, that is possible, very, very rare. But you can get sick and you can absolutely spread it. Even with no symptoms, you can spread it, even if you've been vaccinated. So that is one thing that's different from this variant than the others when it comes to being vaccinated.
Right.
Which is why masking is so important.
Right. And then let's talk about the graphene oxide claim.
Yeah, I didn't even look that up, so you're going to have to deal with that.
Okay. So with the graphene oxide, that's not an ingredient in any of the vaccines whatsoever. If graphene oxide was an ingredient, for one, it would be listed on the respective pharmacy websites, or not pharmacy, but
the pharmaceutical companies, the vaccine websites, they have all of the ingredients listed publicly on their websites.
Right. Another thing is that if there was graphene oxide in the vaccines, you would get like a very dark or even black color to the vaccines. Which, if you don't know, all of the vaccines are pretty much clear, or they have kind of a yellowish tint to them. So there's definitely, like, even if you had just like a 1% of the vaccine was graphene oxide, it would still be like very dark. So there's no way that there's any graphene oxide in it. The reason why they're speculating that the graphene oxide could be quote unquote energized by 5G technology. Of course, the 5G part is part of another conspiracy, kind of thing. But it
gets activated by the 5G network,
right? But graphene is actually a very highly conductive, not element, but chemical compound. It's very conductive to electricity. And so, conceivably, if somebody filled you up with graphene oxide and then, zapped your ass, I'm sure that it would have a very detrimental effect on your anatomy. But the problem is that there's no graphene oxide in any of the vaccines. So it makes them look really foolish, because they're obviously spreading bad information. And this information, you're going to crack up at this, honey. This information comes from this one, this one like professor at a university that attained a sample of supposed vaccine and tested it, and it came back 99% graphene oxide. Now, the sample has literally no way to trace where it came from, or where it was made or anything like that. And it's a purely like speculative, and
they do not care about that.
Shitty. The conspiracy people know,
right? The conspiracy people do not care about that.
I figure if anybody in the Mafia is confronted with this kind of thing, this is something to point out that that this was really, really bad science. And it's the study that they're pulling from for this has already been like shit talked by actual professionals and all this other stuff. So
it's really frustrating. People in certain fields, professors, people with advanced degrees, doctors who spread bad information, false information. It's really upsetting. It's upsetting when anybody does it, but it's more upsetting to me when those kind of people do it, because then people use their credentials to say that they're right, and that's very frustrating.
It really is.
It's really irresponsible of those people.